Go behind. See, it is intestinal and mediastinal affections. No. First show them where is sternum pain or sternoculaar joint. Which joint it is? Please show them in the Google. You can see this is a sternoculaar joint. It is near the clavicular bone, right? Clear? You have to be very careful. Now, how to go here? You see? Go back. And it may be because of respiratory disorder. Recover this pain. You'll love to know, yesterday I've used some of the, after teaching you, I've used some of your processes. I got instant recovery in most of the patients. For example, there was a pain in femoral nerve. I used L3 stimulation perpendicularly going like this. Can you see me? Going from the side, stimulated with my brain muscle pain. Pain immediately reduced from 90 to 10%. And today I'll show you one of the most difficult cases solved by regular medicine or conservatively for 12 years, when recovered in just 5 days. And that is called it heredity. Now the question comes, what is heredity and what is non-heredity? So never insert these joints deep inside. They may create a pneumothorax. Always go oblique. Use a dry needle, oblique. Right? And then mobilization of this technique, prosthetic relaxation, all this you can do. But before that, if you do dry needling with this pectoralis muscle, stretching of the shortened pectoralis muscles, all these are not much required. If you just do a proper process of this dry needle, the pain immediately subsides. You can see the points. Here are 2 points. 3 points are there. 2 here. You have to be very careful. You have to go oblique. Primary points are the red one. And one is in the area of distribution. So if you recover this sternoculaar joint pain, it recovers instantly. Insert dry needle very carefully over here. You will come here, you will see some holes here. So insert very obliquely, superficially obliquely, leave it for 20 minutes, take it out, and the pain is what? Gone. Clear? There are more other points which you have to use for that. It is SP9, SP6, 77.21, 23, 24. Now I'll show you intrascapular pain. Is it clear to all of you? So you will see intrascapular pain. It may be because of the thoracic syndrome also. You must be careful with obstructive respiratory disorder. COPD may be the chance. So coronary obstructive disorder may be the chance. So you have to be careful. But how to recover this pain? If it is musculoskeletal, how to do it. Instantly you can get recovered by this process. You can see. Be careful. Sometimes it is cardiac disorders also. Don't use local anesthesia. It is not required. Go by dry needles. So never insert the needle too high. Always go oblique, right? What you have to do? Go oblique. And then you can see the points. See, regular points needling, I don't do much things. I just needle and I see the pain is instantly relieved. Patient are recovered. And today I'll show you how I have recovered a 8-year-old disease which they considered as heredity muscular spasticity, HSP, was recovered in 5 or 6 days. So you can see these are the points. You can take the area, insert the needle, touch the brain muscle pain. Don't use KWD, please. KWD is not for this technique. Either it's prolotherapy. Either it is purely orthopedic prolotherapy, which I can teach you with glucose technique, and how you can recover this pain within minutes. Pain is gone. And I think you can use it because it is just glucose. DNS. Therapy through muscles, tendons, and ligaments. Yes. So you can see painful shortening of the pectoralis major. The pectoralis muscle, in many cases, it becomes shortening and it becomes very severe pain. Adjuvant treatment of the FICMA, adjuvant treatment for painful sternocostal muscle joints, and adjuvant treatment in respiratory disorders. So this is a very good treatment, especially in pectoralis major. So in pectoralis major, if you do this, you get a very good relief. No need all this. Here are the 3 points. Be careful. Go oblique. So primary point and secondary point. Primary point has to be touched by the pen, secondary point by the fingers. and the pain instantly goes. Sternocostalis. It is a pectoral pain, TTS syndrome, sternocoid dysfunction, pen syndrome following by rib fracture. So even after rib fracture, you'll have a lot of pain. So how to reduce this pain using dry needle? Right? This I'll teach you through prolotherapy also. I'll teach you through uh, this therapy also, and you can recover. I'll show you safest processes this time. Always say depth of the needle should be inserted. Acupuncture kidney channel, especially kidney 22, kidney 27, combination with BL 19, 88 for 14, 15, and 16. These are the points where you have to insert the needles. You have to be very, very careful here because it is a pneumothorax point. You have to go very superficially and insert the needle and leave the joint. No need to stimulate. Insert oblique. Now I will teach you rectus abdominis. You can see miscellaneous complaints in the muscle area, diffuse complaints in the upper abdomen, subradiating, complex by the back, adjuvant treatment and small intestines treatment. Local anesthesia 5 ml is not required. You can recover this pain like this. This time two orthopedic doctors will come and I'm sure you can learn from both of them. Just see the points because you know acupuncture points. These are for injections. We don't need to go for injections. Don't inject very superficially. It may create pneumothorax. Always oblique and short needles. Oblique and
Short needles.
yeah. This is not required at all. These are the points. It's very close to upper area. Transversus abdominis pain, especially subcostal pain, respectively accompanied by chronic respiratory disorders. So those people who have chronic respiratory disorders, they have this type of pain. Less frequently pain syndrome due to work related to incorrect posture. Generally, all the computer people, mobile people, all they have this type of pain. Differential diagnosis is basal pulmonary affection. These are not required. You can see these are the points where you can insert the needle. I made it very easy for you. But always be careful near the lungs. You have to be very careful. Therapy through skin. I made a very big book chapter into a very small chapter for you, into 2-page chapter, so that you can learn very nicely and what? Easily.
Thank you.
Now you have dysfunction gastritis, irritation of the duodenum, acid reflux, pylori spasm. So you will see lot of these are the indications, right? So I have indicated this point.
Mr. Ronnie, please mute your mic.
Next. These are not required. These are the points. Now you can see how far acupuncture and pain distribution through local anesthesia is almost very common. Only we do not know how to correlate it. So I correlated it.
Excuse me, sir. Sir, as said, front and back, both the points you have given, it should be given at a time or some gap difference, sir. Thank you. Thank you.
10-20 minute gap you can give.
Okay, sir. Thank you.
Don't insert too deep. These are lungs areas,
Yes, sir.
right?
Yes, sir.
Otherwise you will create pneumothorax.
Right, sir.
Now you can see pancreatic pain syndrome. These are again very different pain syndrome, and it occurs because of the digestive disorders. So it becomes very painful sometimes because of the pancreatic pain. So how to reduce it? I'm teaching you all anesthesia subject with dry needle. Now I'll teach you after prolotherapy, those who come practically with the help of orthopedic surgeon. One of the best orthopedic surgeons from Mumbai is coming. So he will take the class along with the local teacher. That is why I said do not advance the needle. It may create pancreopathy. Right? Go oblique. Stimulation over superficial stimulation also recovers the pain in many cases. You can see this. Now you can see the points. These are the points which you can use front and back. In one case, which was a very difficult case, at night 12 o'clock I was called up. Painkiller was not working. And then this, yes, it really helped me to recover this. And now you can see adjuvant treatment in recurring urinary tract infection. It is most common here, you can see. UTI infection is most common. So how to revive it? See? How acupuncture and anesthesia is combined. This is called prolotherapy. So you have to use T9, T12, L1. These are the acupuncture points. You can compress them or insert the needle. Primary area of the pin. You can see this is the primary area of the, insert the primary injected points, and these are the area of the distribution of point. So these 3 points plus these points. Be careful, kidney is very near, so don't go near very deep. This time we'll have advanced prolotherapy class, practically. Ovaries and fallopian tubes. Recurring inflammation in the ovaries and fallopian tubes, pain syndrome during ovulation, pain ovulation cyst. So this is generally found in gynec symptoms. You can see how to revive this. Generally, I use advanced brain pain, Parkinson pain, and brain stimulation. So they were, there may be ovarian tumor, big confirmed with the complete diagnosis. If such cases come, first diagnose it, then treat it. Because the differential diagnosis is ectopic pregnancy and ovarian tumor. Local anesthesia is not required. Needle is important. There is no need for this. That is transcranial electrical nerve stimulation, gynecological treatment. You can use acupuncture also, reflexology, need 10 until L1. These are the primary points. So don't insert near the genital area, use other area. 1, 2, 3, 4. 4 pain is enough. Pain will be relieved. So for today, we'll complete this class up to here because this is a very big chapter. And now you may ask your questions for 15 to 20 minutes. Doubts and questions are most important thing which you should clear in your mind. How many of you believe that heredity spastic disorder cannot be recovered? First, write down what did heredity spastic disorder in Google. Go to Google and write heredity spastic disorder, SP.
Okay, opening Google.
For sports physiotherapist and all, it is very good treatment.
Yes, sir. What do you want from Google Chrome, sir?
My video of today.
Okay, from Facebook.
I want to show you a case study which was diagnosed in 2012 as what? Hereditary spastic disorder. She was unable to walk. Her pain was very severe and she could not even walk for few minutes. And you can see open the pages one by one and you can see it is written as hereditary spastic disorder. So in Google you can see what is hereditary spastic disorder. Yeah, you open this page. In 2012, if you see, she was diagnosed with HSP and she was only given muscle relaxant, after which from last 5 years, she is suffering from pain, but she is not taking any painkiller or anything. She has not visited any doctor for the last 6 years. Now you see what is HSP, hereditary spastic disorder. What it is written?
Hereditary.
Is a rare inherited disorders, use weakness and stiffness of the leg muscles, and she was not able to walk. Right? Now, after 5 days of treatment, you can hear the statement of the patient. She is suffering from 2012. This is M.K. Shastri. We often get a very difficult case. This is a case of 10/1/2012 of progressive spastic paralysis. एक progressive spastic, hereditary progressive spastic paralysis. Patient was unable to walk with very difficulty in walking. You can see 2 to 3 years. You can see. In 2012 means she is suffering from 2009, and then she was diagnosed in HSB as progressive spastic paralysis. By confirmed by 2 physicians. अब जब आए थे तब आपको कितना दर्द था मेरे पास?
मुझे पूरा स्टिफनेस था पूरा थाइस में यहाँ जब थोड़ा सा फिजियोथेरेपी किया और पेन लगाया सर तो इंजेक्शन दिया तो
अब कितना आराम है?
50% कम हो गया स्टिफनेस तो कम हो गया दवाई तो ये लोग दबाते तो बोलते नहीं है दर्द तो पहले चाहिए तो आई यूज्ड टू शाउट वाह
अब चल के देखिए कितना दर्द है।
नहीं चलने में कुछ दर्द तकलीफ नहीं है मुझे
दबा के देखिए खुद दबाइए। She is saying now she is having no pain while walking, while standing. Is pressing and seeing whether she is having pain or not.
बहुत कम
कितना कम हो गया?
50% तो कम हो गया
तो फिर अब दबाने से दर्द नहीं तो 50% का कहाँ पे कम हो गया?
बस मुझे चलने का थोड़ा अग्रिम चलना चाहिए
Within 5 days. Yes, ma'am.
कितने दिन में हुआ आराम?
5 दिन हुआ मुझे
5 दिन हुआ। 5 दिन में आपको लगा इतना आराम आ
आराम
जाएगा?
आ गया
आपको लगा इतना आराम आ जाएगा?
नहीं लगा इतना क्रॉनिक था तो मैं सोची कितने दिन लगेंगे नहीं जाऊंगी कहीं डॉक्टर ने फिर ये ट्रीटमेंट करके देखूंगी एक बार बस और कुछ तो मैं नहीं जाऊँगी कहीं तो मैंने मना कर दिया एलोपैथी की ट्रीटमेंट खाने से पेन किलर्स देते हैं और बस दवा से इनकम हुआ फिर से आगे
So she is suffering from a very rare disease. It's called progressive spastic paralysis, the rest of the rare disease, and she is having crippling episode. She was unable to walk with very severe pain. Now you could see even after pressing, press kar lo, there is no pain in the patient. Otherwise she used to stop with the pain. Just press kar. Now you can see she has got almost 70% recovery. It's with one finger support also she can walk. ये आगे पकड़ कर रहिए चलिए आराम से चलिए वहाँ एक आंगली पकड़ लो हम एक आंगली पकड़ लेंगे You can see she's walking with one finger support. आपको चलने में कितना तकलीफ हो रहा है?
तकलीफ तो नहीं, डर है बस, तकलीफ नहीं।
हाँ ठीक है, डरिए मत। कितना आराम आ गया?
डर चलेगा तो बस है, मुझे तकलीफ खुशी होगी।
कितना आराम आ गया?
आराम तो आराम,
हाँ?
आराम 50% से बाहर क्या है?
There is no more on any medication.
बैक एक भी कम हुआ थोड़ा, बहुत कम हो गया।
बहुत कम हो गया। आगे बैक पेन कितना था?
पहले बहुत बैक पेन था, तो उठते नहीं था, इस चेयर पे भी नहीं उठ सकती थी।
She was having severe back pain. Now you can see now her back pain is gone.
तीनों फोटो हमको खींचे मोबाइल में।
You can close down the video and ask me the questions. You can ask questions.
So, this PSP, you said it's hereditary, so it means that we can't prevent it from happening?
Pardon me?
PSP, you said it's hereditary, so does it mean that
HSP.
we can't?
Yeah, they said that it is HSP, but I do not believe it is HSP.
So it means we can't prevent it?
A patient is recovered, you see in 5 days. Patient is walking, her pain is not there. What is the patient? When I arrived was 5 days back, her pain was 10/10. 6 years back, she has stopped going to doctors. She said, let me suffer from pain. She was not able to come down from the car, right? Now, even if you touch her, she used to feel severe pain. Now, where is her pain?
Okay, but you're saying that it's hereditary, so what about for like other members in her
I doubt
family?
it is heredity.
It's not?
No, that is why I say, na, go with your own diagnosis. You must have a good knowledge. That is why I teach much about diagnosis. That if you have a good diagnosis, others' diagnosis, don't believe, whoever he is, don't believe others' diagnosis, believe your own knowledge. Yes,
Okay, sir.
I believed my own diagnosis, I treated her. Now you see the patient.
But is it something that can be prevented, sir?
She is recovered. What did she say?
No,
She
no,
said,
I
"Do not
mean
pay."
like for other people, is it something that can be prevented? How did she get it
This is
then?
the rarest of the rare disease. She had it around 12 years back. She was for 6 years on painkillers, then she stopped it, and now she was suffering, continued to suffer from pain. Now you see the pain recovery.
Okay, sir.
She's able to walk.
Yes, sir, I see.
See, for emergency situation, allopathy is very good. But in chronic situation, recovery part, this part is also required. I never say allopathy is not required or Ayurveda is not required. Everything is required. But when such situation comes, this is also required. Because patient needs good relief. She said, even if I don't get relief in 4 or 5 days, I'll stop this treatment. Now she is happily taking this treatment. More questions? More questions?
Good evening, sir. This is Anand Maurya.
Yes.
Sir, spasticity is the upper motor neuron disease, and the patient has a main complaint is the pain.
She was having severe pain and spasticity. She was unable to walk.
Means something is there in the spinal cord or brain.
Brain, spinal cord, and local neurogenic. Three things were involved. Because whenever spine is involved, neuropathic symptoms are involved.
Yes,
This is
sir.
how I have learned new thing after bringing NCV. First, I recovered and you have seen how I recovered, how I have reduced the time of recovery of the spinal cord injury only with the help of NCV test. I modified whatever I taught you. I've changed everything in my life. First, suit conduction in a typical way. Then, clearance of the pathway, which brings endorphin to the localized way, which has become weak, and then strengthen the muscles. Patient recovers. Now, can you believe 12 years pain can be recovered in 5 days? 5 sessions, not 5 days also. Hardly 1 hour, 2 hours.
No, sir, it is not possible. Even the patient suffered 12 year. I think many hospitals he can visited already.
Yeah, she has visited the best hospital of Hyderabad. You see in the prescription. That's what I said. Learning is very, very important because there are large number of problems which you will encounter. And if you go strategically, the pain goes away very beautifully. Today, the chairman of the consumer court came to me, who appoint judges to the consumer court. He had a severe knee pain. I reduced it in just 1 minute. So every time research should carry on. Why is he having pain? How to reduce? Everything, every day new ideas should come out. You see, these new points have come out. Now, how to give product therapy in these new points? I have chosen an orthopedic doctor who's coming from Mumbai and a local orthopedic doctor who will teach you both simultaneously how to recover this pain. With the help of only glucose and soda bicarb. That's all. And dry needles. This is what I wanted to teach you all. But the question is that you people have to sit and discuss. You will think that I'll discuss in the group. Then others feel angry that, oh, only I'm giving importance to him. I'm not giving importance to him. Syllabus is incompleted. So whatever extra time you find, you have to discuss that part. This is what the chart I wanted to give it to your friend. That yes, you go with this way, this is the process, and your pain, mother's pain will reduce in just 5 days. But now the days are changed. Teachers are different, students are different.
What when we can do? We can just suggest.
No, we should not even suggest. Tell me what we should do.
Then what's the
Carry our way. Why should we suggest anyone? If it's not, see, if it does not respect me, if it does not love me, why will he hear me? with the help of just pain stimulation, you can recover this type of pain. You don't even need needles. It requires stimulations, that's all. And how good it is in sports therapy, now I realize when I'm working with this type of patients coming to my clinic. My entire brain mapping has been changed. I'm trying to bring muscles into points, deltoid into one point, posterior deltoid into another point. I'm getting results. See, I told you, I taught to large number of students. People think that knowledge is limited or we have limited knowledge. It is not like that. We are clinical people. We get lot of knowledge in the clinic, right?
Yes, sir. Clinical is very, very, very difficult.
So why medical college professors are good? Because they get lot of clinical cases, right?
Yes, sir.
So we get lot of clinical patients, right? So how
Yes.
to recover each clinical patient? We learn and we recover it. And the way we recover, we teach you. But if you think I can learn everything in 5 days, I can practice, I can become a specialist.
No, sir, it is not possible. The practical is totally different. Lots of things, there is a differential diagnosis is there.
Yeah. You see, recently I recovered one breast cancer patient with brain stimulation with only 3 needles. She was tired with chemo and all. She said, I won't take any more things. Can you help me? I said, yes, I will help you. Come up. And one fibromyalgia pain who was suffering from 6 years has recovered in just 2 days by 70%. She has not taken painkillers. She was regularly taking painkiller for 6 years. From last 2 days, no painkillers. She'll come tomorrow, I'll take her statement. More questions? More questions?
Hi, Ji.
Yes.
Shalom.
Hmm.
Can dry needles recover ovarian cyst?
It's very difficult to say because I have never recovered ovarian cyst. They don't come to me. I'm not a gynecologist. In India, I'm not supposed to do that.
So only can manage pain.
I can do neuro cases.
Mhm. How about PMS?
Very difficult to say because we have not treated all these things. We always deal with what? Typical paralytic cases, which others cannot solve.
Right.
Who will come to me? Only those patients who cannot be solved.
Mhm. Because sometimes they do want surgery.
Surgeries are required, everything is required. Wherever, whatever is required is required.
Thank you.
Any more questions?
Kama hakuna workshop
More questions? See, today is a time we should study and become an expert. Tomorrow you have to show your expertise to the world. At the age of 45, 50, you won't have time to study or get expertise. So it is a time when you have to expertise you. This is your investment. That's all what I say. Any more questions?
No, sir.
Yes, tell me.
No question.
Thank you so much. Take care.
Thank you. Good night.
Good night, Sastriji.
Good night.
Good night.
Good night, everybody.
Good night.
We're shutting down the class.
Good night.
Good night.
Good
Thank you.
night, everyone.